Good afternoon, and thanks for coming back to Facebook Live here at the Oneida Nation Reservation in Wisconsin. We've been doing this for a few weeks, and it's a great way to keep contact with our people and inform them as to some of the things that are impacting us on the reservation relative to the COVID-19 pandemic. So we've been bringing people in to talk about the different areas that are being impacted by this pandemic from the Oneida Nation. Today we have with us our Public Health Information Officer, Michelle Myers from the Oneida Nation's Public Health Department. We also have Geraldine Danforth, who's the director of our HRD department. And also we have Debbie Thundercloud, who's the general manager of the Oneida Nation. So we'll start with our latest health update from Michelle.
Thank you. So many prevention measures have been implemented over the past couple months to slow the spread of COVID-19 in Wisconsin and here in the Oneida community. These measures were implemented gradually using available information at the time. Today we continue under our Safer at Home order. This order directs individuals to stay at home with limited exceptions. All individuals may leave their home for essential activities including health and safety, such as picking up medications, visits with healthcare providers, shopping for necessary supplies such as groceries, food, pet supplies, and other necessary household items, taking care of others including family members, friends, and pets, and the travel associated with these tasks. Some examples of allowable outdoor activities could include walking, biking, hiking, or running while maintaining social distancing. It's critically important to avoid group activities such as ceremonial sweats, as this activity often brings a group of people together. The preferred method would be if the sweats could be held with only the people that live in the same household. It is important to avoid activities that bring groups of people together, such as team sports or contact sports such as basketball. This can be really challenging right now as we approach nicer weather. Rummage sales, garage sales, flea markets are not essential activities and should not be planned or attended right now. Earlier this week, Wisconsin Public Health released information on how Wisconsin is doing to flatten the curve. And at the end, we'll have an image that kind of demonstrates that. The data is demonstrating the prevention measures are working. This is great news, but we must be vigilant. This is not the time to flip the switch and return to life as it was before the pandemic started. To do so now would likely mean drastic increases of COVID-19 cases. Yesterday we learned the Wisconsin Safer at Home order will be extended through May 26th. It is more critical than ever to continue our prevention measures. Each of us has a role in protecting the community. When the Safer at Home order is lifted, we should expect to see a slow, progressive return to normal. Businesses are actively planning and implementing prevention measures to keep employees safe as they return to work. In addition to flattening the curve, work continues to improve healthcare capacity to handle pandemic situations. This behind-the-scenes work will take some time, but with the lessons we are learning now, we will be even better prepared for future responses. I did want to provide a brief update from the Oneida Comprehensive Health Division. As a critical point of contact, we want to make sure you know that we are open, but like others, we are doing our business differently during this outbreak response. As an example, with the recent layoffs experienced within the organization, we have anticipated the need to establish new patients. We do have a process in place for completing this by phone. We encourage you to call ahead with concerns about your health and well-being. Staff are happy to assist you in answering questions and guide you to available resources. We have updated our resource information posted on the nation's website in the COVID-19 section for a quick review of hours of operation and contact information. Thank you. And with that, I will turn it to Geraldine.
Thank you. I'm going to talk about some employment updates. When the COVID pandemic began in Wisconsin, the organization's goal was to minimize the financial impact closures would have on the nation's employees. The casino has been closed for 4 weeks without our primary source of cash flow, and after 3 weeks of paying employees emergency copay, the Oneida Nation had to reduce payroll expenses. And how did we determine that? Well, we had the business unit submit a Tier 5 contingency plan with approval for detailed explanation of essential and non-essential employees. Those employees were placed on layoff or furlough. The difference between a layoff and furlough is that furlough employees are meant to return to work as quickly as possible. Last week, approximately 1,900 non-essential employees were furloughed or laid off. 827 employees remain, and several employees have taken reduction in either hours or in pay. So here's some information on employees not working. All employees not working should have received a layoff or furlough notice. Insurance benefits will end at the start of the layoff or furlough. The benefits department has been working on sending letters to those employees that have lost their insurance coverages. Benefits will be reinstated when employees are called back to work. Unemployment eligibility is determined by the state, so if you have not done so, please apply as soon as possible. We have resources to help, whether it be at the CEC for computer use, or if you need some personal help in filing, we have Sean Paulus, and we will post that information on the Facebook when we're completed. Employees should be using the date of April 11th for their filing unemployment as your last day of work. If you received a denial letter, you may have to refile if you used a date other than April 11th. Self-service will remain active through the furlough and the layoff. The self-service will provide informational resources such as insurance, unemployment, EAP. You can also update your personal information, and there are also key phone numbers that can be found there. Just one reminder, if you are on layoff or a furlough, do not do any work for your current position. If you are having trouble coping with the stress of your situation, please call EAP. For those employees working, thank you for your work you continue to do. Be safe and stay at home if you are sick. If you need time off for COVID-related reasons, please contact your supervisor to determine time off options. With supervisor's approval, you may use accrued vacation and personal time. Employees with reduced hours may use vacation and personal time up to the amount that they are scheduled. If your hours are reduced, your current insurance will remain in place, even if your hours drop under 30. If the pandemic lasts for more than 12 weeks, this will be reassessed and benefits may end based upon your average hours and employment status. As a reminder, there are resources in the self-service under the layoff tab with helpful numbers and emails to help with questions and communication. Stay safe. We are looking forward to the days when we can welcome our employees back to work. Thank you. And with that, I'll hand it over to Debbie Thundercloud.
Good afternoon, everyone. The General Manager's Office oversees a number of areas within the organization, including the Division of Public Works that houses our utilities, custodial, groundskeeping, housing, all of the infrastructure that take care of all of our buildings and grounds and all of the physical structures in the organization. We also have the Governmental Services Division that provides social service programs like Indian child welfare and economic support, higher education services, child care, transit, and many others. The Comprehensive Health Division continues to provide medical and behavioral health services. And finally, the Environmental Health, Safety, Agriculture, and Land Division that has many of our food system provisions like Junhekwa, the farm, the apple orchard, and the cannery. This isn't an exclusive list, but just a few of the highlights of the areas that fall within the General Manager's prerogative. At this time, our operations are focusing on 4 main objectives, and that is to make sure that our community is provided with the necessary health care services, shelter or housing, food provisions, and then the infrastructure or the support systems that help support providing those services. There are many food programs available to our membership. We have food service delivery in the Elder Services program under our Head Start and our Oneida school system, which provide daily meals to children and families. We have a food distribution program, which is located over in the business center. We have SNAP, which is the food stamp program. We have WIC, which is for women and infant nutrition, and those are all income-based programs. And then we have the Oneida Food Pantry, which is open to every enrolled member, and the provisions are based on your family size. What we want to ask everyone is to be mindful of everyone in the community and the food safety needs that everyone has, and please don't take more than you need, and save provisions for other family members, for your neighbors, your brothers, your aunts, your elder parents. So let's be careful about how many times we seek out those services and make sure that they're absolutely necessary so that we can share the abundance with everyone across the community. At our senior management team, we're discussing what our new norm is going to look like and what it means for our nation in terms of the service provisions that we provide. At this time, we don't have a timeline of when or if we'll be able to recall our employees. It's an unknown factor for many businesses across the country. We do ask that when we start seeking input and information from the community, that you participate in our surveys or provide information for assessments that we're going to be conducting to establish that new norm and what that will look like for our community. So we really want to encourage you to provide that input to us as we reshape our nation. We also want to encourage you to continue to seek out economic support services if you're in need of those. Things like assistance for needy families, child care assistance, utility assistance. Our business committee adopted a resolution last week that is forgiving rent, mortgage, and utility costs for those tribal members that are a part of those systems within the organization through our housing division. So there'll be information coming out to you if you reside or participate in any of those services as well. I also want to take this time to thank our leadership. They've been through a grueling month. It's been very difficult for everyone. A lot of hard decisions have had to be made around our cash flow and making sure that we provide for the stability of our nation into the future. And so I want to thank everyone for working together and making sure that our community is being very well taken care of and that we're providing information and continuing to provide those critical services thanks to their leadership. So we're all working to do the best that we can, and we want to encourage everybody with good thoughts and good prayers. Thank you.
All right, thank you everybody. We do have some time to answer some of the questions. Your questions that pertain to employment, administration, and healthcare today. The other questions, we'll look for the answers, post them on our COVID website when we get the chance. But one of the questions that has come up continually has been about Indian preference. And so Geraldine, I'm going to just ask you to explain Indian preference and how that may apply or not apply to the layoff, furlough, and eventually rehiring.
Under the normal layoff SOP, one of the criteria is if all things being equal, that you would use Indian preference in that category. This declaration is a little different, and I would have to get back to you on that answer and how it's applied.
Okay, that's fine. And we don't have the answer to every question and every concern, but we do want to acknowledge the questions, the concerns, and we would like to get back to you. As I said, go to our COVID webpage and look for that in the future. Also, there's other options for critical positions. Oh, I'm sorry. The question is, Is there the option to transfer over to a critical position if that's open? And how do you find out when those are available?
Geez, we haven't come across anything like that yet. Well, I guess there have been a few, like in the nursing home, with the meals area, the dietary aids. They've been looking for help. I know we've also been working with some nurses and moved a couple of nurses around. But we just need to know from the areas if they need the help and if we can get something out to announce whether or not something's available.
Thank you. Debbie, I'm not sure if this is under your area or not, but an individual who is homeless, how can they access some resources? What kind of contact information and what resources might be available for those individuals?
The Housing Authority, through Housing and Urban Development funds, do have a set aside for providing assistance for homeless individuals. So if they would contact our Housing Authority, they do have a process whereby they would be providing those kinds of services.
Okay, what we'll do is we'll get the numbers for the Housing Authority also posted on the COVID webpage. It's taking me a while because some of these questions are coming up and getting through before I can read them. Do we have any idea how long our operations may be in Tier 5? Not sure if Debbie, if you can answer that?
I don't have a definitive answer. I know that we are watching the cash flow very carefully, and we have a fiscal policy that whereby we try to live off of the cash that we have at hand, and then there's our investment portfolios. And I believe we have until the middle of May where those cash resources will be available to us. And after that point, then we would have to start looking at liquidating investments.
Okay, another question that has been coming up, and we can't answer that, but we'll certainly look to find the answer, and that is about mortgage payments and Bay Bank. So we'll have to approach Bay Bank and ask them if we can get some information for our viewers on Bay Bank. If there are any other questions that you would like to see answered, please submit them. We're doing our best to answer them, and we try to answer them in real time. That's not always an easy job.
Bobby, if I could, with the Section 184 home loans through Bay Bank, the federal government has issued a deferral where people, if they are having a hardship, they can contact their lending institution and they could possibly make arrangements to make those payments at a later date if they're having a hardship.
Okay, thank you, Debbie. Another question that comes up is the question of layoff versus individuals that have seniority. Geraldine, I'm not sure if you can answer that. It's a pretty broad question. Individuals are concerned that they had many years of service or feel that they've been here longer than others and they were laid off before people who came in were employed after them. Geraldine, can you help us out with that?
Again, I'm going to go back to not having the answer to that because we're not following the standard layoff SOP. We're falling underneath the declaration and the criteria in the declaration, and I don't have that handy right now.
Okay. Well, that's going to just about wrap up our segment today. Keep your questions coming in. We'll take as many as we can and post them to get answered. We've had a lot of questions, a lot of interest. The subject of employment and services has been real critical to the community. And the Oneida Business Committee, the COVID-19 team, and everyone has been working. As soon as we get information, we try to communicate it out. As we know, the governor of Wisconsin has extended the Safer at Home order through May 26th. Questions have come in. Is the Oneida Nation in alignment with that? The Business Committee will be meeting and will be making a decision on the terms of Safer at Home and what may be lifted in part and how they're going to be addressing that. Their meeting is scheduled for next week, so we will have information as soon as the meeting is concluded. They have to make their determinations and change policy. It's not just something you can say, yep, we're gonna do this, we're gonna do that. They passed policy and declarations in order to invoke some of the restrictions that are in place. So they also have to amend those policies through the policy process and as a government, the way they invoke them in the first place. So we thank you, stay safe, say your prayers, be good to one another, and we'll have another Facebook Live Monday noon. Thank you.